Retinols, retinaldehydes, retinoic acid, it's all so confusing. Whether you're on one now and you want a little refresher or you just want more results from it, if you're on a retinol now and you're not seeing the results you want, let me show you how to 3x it. Or you're thinking about starting it because you've heard so much good about it. Today I'm going to talk about everything retinols, purging, dosing, how to use it, how to maintain your facial fat. Can you lose facial fat from it? And at the end, I'll give you tips on how to maintain that. Facial aging comes from the loss or the displacement of facial fat in the face and of course bone loss. Then you get sag, jowls, under eye hollows, and the whole gamut. Study after study is going to tell you the benefits of retinol, as well as every dermatologist and plastic surgeon putting their patients on these. But here's from 2022. Let's look at what they say. The anti-wrinkle effects of topically applied formulations containing retinoids are based on the promotion of keratinocyte proliferation, we're going to talk about that later on, and collagen synthesis. Why we look old is lack of collagen in bone. There's collagen. Improvement of the epidermal barrier. The epidermal barrier is just about everything. It's so important, and this improves it. Inhibition of collagen degradation, because especially after the age of 40 or 50, we degrade more collagen and hyaluronic acid than we make. So I always talk about the machinery, the change in the machinery. That's what I'm talking about. Improvement of transdermal water loss. You'll hear a lot more about that. And these you'll hear a lot more about too. Metalloproteinase activity, MMPs. They basically chew up your collagen. We study those in Sculptor and Sculptor studies where we're injecting and staining for different things. And we want to inhibit the MMPs. Retinoids act through retinoic acid and retinoid X receptors. Considering the molecular structure and receptor selectivity, retinoids are classified into 4 generations. So there's different ones, but that is the function of the premise of why you want to be on them. There's retinoic acid, you have retinaldehyde, retinol, retinol palmitate. That's the order of strength from stronger to less strong. The ones at the bottom are converted to retinoic acid. What's my preference? Retinaldehyde, the second one down. The reason being it's a single step conversion to retinoic acid. Retinoic acid is the strongest, but for most people they're going to get too much sun exposure, inflammation, sun damage, irritation, skin tightening, not in a good way, but from the inflammation feeling of the retinoic. So the retinaldehyde is the natural choice. At the end of the video, I'll tell you my favorite one, and it includes multiple types of retinols in it. Let's talk percentage. So for a retinol or retinaldehyde, think 0.5% is a good rule of thumb. What's key to know here is as you go up in the dose of percentage, the effect isn't linear, meaning, let's say you went from a 0.5% to a 1%. Are you going to get double the amount of skin tightening and effect, potentially irritation? No. So there's a sweet spot in there. Getting a 5%, which would be a huge dose, isn't going to mean you're going to get more effects. In fact, that might be worse, but it's not a linear relationship. So anywhere in that range is pretty good. Now, how are you going to apply it? You want to apply it to dry skin. A pea-size amount is enough. Some people would say use the product on moist skin or just after washing, or even apply a hyaluronic acid serum first because that's going to increase absorption. While it may not be the best thing, because more absorption means maybe it does get down to the fat pad layer if that's something you're concerned about, but also you can just increase your frequency of use. That's much better. Now, how often should you use it? You want to start, if you're real conservative, real sensitive skin, once per week is fine. If you want to be a little more aggressive, 2 to 3 times a week for a 0.5% product is going to be just fine for most people at night. Now, it can be actually applied in the morning. It's not that retinols make you more sensitive to sun because of the product in the sun interacting? It's because your skin is going to have more inflammation because it's a new product to you. Maybe you've increased the strength, maybe you've increased the dose, and you get a little bit of inflammation. Everyone is going to take themselves to that limit of feeling a windburn feel because you're like, oh, it's working now. But then you need to pull back. You want to be just underneath that feeling of a windburn look. If you're having that windburn feel or sensitivity of skin, you're dry, you're flaking, when you see the sun, when the sun sees your skin, that's going to cause photoaging. That does cause fat loss. Solar damage is probably one of the worst causes of fat loss in the face that we can get. So it's not that the retinol is causing that, it's that the skin's irritated and inflamed. So you never want to have your product taking you to that level or beyond. And when you feel that irritation, dryness, sensitivity, you want to pull back a little on your dose. Not the pea size amount that you're using, but the frequency. So for some of you, it's going to be once a week. For other people, it's going to be 7 days a week. That is where the most failures occur with retinols, is that people have to understand everyone's dose is specific. And the reason is, back to my beginning statement of the different types of retinols and the conversions. Remember I said the retinaldehyde is a one-step conversion to retinoic, and the retinol is a two-step conversion. We all convert it differently and have different sensitivities of the skin. And so you just have to understand you're going to play with the dose. And if you have someone to guide you, watch my further videos on that. They'll help as well. But inflammation is not your friend. Now, how do you layer it? Well, for many people in great products, you don't need to layer it. At night, you cleanse, take all the makeup off, and you just apply it to dry skin. That should be enough. Honestly, keep it simple. If you want it a little more powerful, yes, you can have your skin a little bit damp or apply a hyaluronic acid serum first, wait 2 minutes, put your retinol on. If you need to buffer it, if you want it to be less strong, you can put a moisturizer on before your retinol or after. Before will really dilute that down and decrease the absorption. After will just buffer it, but a little bit less. So you can use those type of layering methods, but of course you don't need sunscreen at night. Most people aren't exposed to sun at night, so you can skip that step. Let's talk purging for a minute. Is it real? Do you purge? It's a little bit of a misnomer, but yes. What's happening is retinols increase cell turnover. So that dead layer of skin that was thick is now thinner in a good way. Although the skin can be a little sensitive if you use too much, in a good way, because you got living skin cells there now, or you're closer to the skin cells that are living, and the dead outer layer is gone. What ends up happening is the pimples that were going to come forward, the closed comedones, or the different forms of acne on your face, it's going to accelerate them coming forward because you're removing layers of skin cells. So in a sense, it was going to happen anyway. It's just all happening at once now. So yes, you do get a little bit of a purge. It's going to be different for everyone. It could be at day 3 to 4 or as far out as 3 to 4 weeks, depending on your dose and your skin and how well you're taking care of your skin prior. If you're doing a good job of maintaining it, there's less purging, but purging can occur. Work through it. So what are 3 things that are really going to help your retinol work? Well, number 1 is copper. And copper is needed for collagen building. Think about fresh leafy greens. Think about different foods high in copper. Number 2, you're going to think vitamin C. Now that could be taken orally, it's great, but also topically is wonderful. You can use a nice vitamin C serum in the morning. In my formulation, I include a vitamin C with the retinol. And many of you think that this may not be possible, but THD ascorbate from Japan, it's one of the best ones. It's lipid soluble, it's stable, and it's already in my retinol A. And the third one is collagen peptides, low molecular weight collagen peptides, because they help form the building blocks of your skin integrity, support hyaluronic acid, and the structure that's needed to help remove wrinkles and fine lines. And you can watch my videos on the recent studies where collagen powder reversed lines around the eye. They did study low molecular weight collagen peptides. You might look for those, and the dose for those. They did 1 gram a day in the study. A typical collagen powder, a scoop, is usually about 7 to 8 grams, so you're getting more than enough. Now, my favorite retinol is Rajani MD. It's retinol A. Why? What's in there? Retinol palmitate, you have retinaldehyde, and retinol. All 3 are in there with a vitamin E, but most importantly, one of the top ingredients there is avocado oil. Avocado oil has vitamins A, D, and E, fatty acids, and beta carotene. Those are all necessary to help build collagen and integrity in your skin. So I include that as a top ingredient. It also helps avoid any irritation and inflammation. If your retinol product does not have avocado oil, you can always add it after application or the next day or on your nights off. I also like sunflower and safflower oil. I have complete videos also on facial oils. I put one up here on retinols and one down here on skin oils, inexpensive skin oils that you can use to keep your skin and body beautiful, healthy, and vibrant.